Okay, I'm here with this great hero, Wendell Potter, who was the former senior executive. He'll tell us exactly what position he had at Cigna. And he has very graciously giving us a little bit of time before the Bill Pascrell town hall. And he knows that I did a diary yesterday about my meeting with him, and I've asked a lot of questions, and he just wants to say hello to Daily Kos and tell us what it was like at Cigna headquarters during the Natalie Sarkisian tragedy. So I'm happy to introduce Wendell Potter.
Well, thank you very much. As you mentioned, I was senior executive at Cigna. I've been with the company for 15 years almost, and I left in May of 2008. The last job I had, I was chief spokesman for the company and head of corporate communications. And I was on the hot seat as the spokesman of the company during the sad story of Natalie Sarkisian.
What happened tell us if you could, what it was like at Cigna when the Netroots sprung into action and tried to get Cigna to reverse its decision. What was what was it really like being there at that time?
Well, it was a very, very tense time. I was actually out of town when it first began, and I came back to the office as things were really getting active. The Netroots were getting very involved, and it was a very, very effective. I want to say that you all were very, very effective advocates for the Sarkisian family, and I think that because of your efforts, the company did ultimately make a decision, not regrettably too late, but made a decision to approve the procedure.
Wendell, yesterday I wrote a blog on Daily Kos, and I mentioned that the blog was about you and that we were going to be meeting, and a lot of people had some wonderful questions, and I'm just going to sort of shoot some questions to you, and if you could give us some information about how the insurance industry operates.
Sure.
One of the questions was, how does Cigna how do insurers, or you work for Cigna, how do they really deny claims? I mean, are employees trained in denials? Are there quotas, incentives, vision statements? Can you sort of walk us through how the anatomy of a claims denial a little bit?
Well, I'll start with the top. At Cigna and other for-profit companies, and by the way, the industry is now dominated by 7 very large for-profit insurance companies. About 1 out of every 3 people in this country who are insured, their benefit policy is one that's managed by those 7 companies, and Cigna, of course, is one of the largest. And what happens is that these companies are under constant pressure from Wall Street investors, the institutions that own them, and from the Wall Street analysts that write about them, to always be a little more profitable every quarter than they were the previous quarter or the year before. So there's constant pressure from Wall Street to enhance shareholder value, which is a term they use all the time, to make sure that the earnings per share meets Wall Street's expectations, and to make sure that the other measure that's unique to the industry, the medical loss ratio, is going in the right direction from an investor's point of view. So you've got that constant pressure, and employees at all levels are made aware of that because the company executives hold internal town hall meetings to make sure that the employees know how Wall Street reacted to the last earnings report and what all the employees need to do to meet the company's overall strategic imperatives, as they call it. So you've got that constant pressure. It's always a reminder. These companies having to report to Wall Street every 3 months, it's ever present that the company always has to do that. And that translates into how everyone in the company does his or her work. And if you are involved in claims management or reviewing claims, you make sure that you're not paying a claim that might not be a covered benefit. You look very closely to determine whether or not through the language in a policy or a requested procedure, whether it might be perceived as something that is medically unnecessary, experimental, or investigational.
Wendell, this brings me to two other questions. First question is, and I'll ask you both so I don't forget them, what will healthcare reform look like in the United States without a public option? That's number one. And number two, and this is a question that's been troubling me for God knows, well, since before you came out, so to speak, what does it say to you about the political system that the political class has you testify before the Senate? They know full well what you're saying is absolutely accurate, yet even after reform, even if we get a public option, the private insurance industry will be at the center of our healthcare system. So I guess the first question is, what will reform look like without a public option? And then the second one, what does this say about our political system, that we will continue to have a healthcare system with the private insurance industry at the center of it?
Well, I think healthcare reform without a public option will not be true healthcare reform, and it very likely could be reform that is shaped largely by the health insurance industry, and it will benefit the insurance industry more than most average Americans. A public option is absolutely vital. It not only will provide coverage to a lot of people who don't currently have coverage, and provide it at with a premium that is not overpriced as we currently have it in the private market, but it will help, as the President has said in the past many times, to help keep the private insurance industry honest. However, you're right that even with a public option, the private insurance industry will still be very much a major force in our healthcare system. Since the last time we had this debate, over the last 15 years, the private insurance industry has gotten an even firmer grip on the healthcare system than it had back then. As I noted earlier, the industry is dominated with very, very large for-profit insurance companies that have essentially formed a cartel that control the healthcare system. It will still exist, but a public option is completely essential to make sure that we have at least some balance to the pressures from Wall Street.
Wendell, have there been efforts to discredit you since you came out, so to speak? Have you been targeted by your former employers, or by AHEP, or by Miss Ignagne, who runs AHEP? Have you been, what has been your life like since you started to, you be the whistleblower? You're the to take down this terrible industry.
Well, it's been an interesting life. I knew when I gave that Senate testimony that my life would change. The industry has tried to discredit me, not directly. I didn't expect them to do it directly, because one of the tactics that they use is to try to discredit their detractors and to kill reform using shills and front groups and third-party advocates so that they don't get their hands dirty roughing somebody up or trying to kill reform. So that's what I expected. What I am seeing is sometimes in the right-wing blogosphere, I'll see attacks on my credibility. They're pretty weak attempts, at least they have been so far. It's pretty much as I expected.
Wendell, I sense in you, of course I just met you, but I sense in you a man that didn't just I know the story that you went to the remote area medical in Wise, Virginia, and you saw what was happening. But you strike me as a man who's been deeply conflicted about what you were doing since long before that. And I think you may have even sent me an email that even during the Sarkissian